In this lecture, I'm going to talk about post-streptococcal glomerulonephritis. And actually, the story of this disorder start when a child, for example, get repeated infection of tonsils with Streptococci pyogenes or Streptococcal pyogenes. This is bacterial infection. However, some of the dead Streptococci, they reach, circulate and reach the kidney, and of course we don't know why these dead antigens of Streptococci they come to the kidney and they find their way to the basement membrane. As can be seen here, this is a glomerulus of the kidney, and this is the basement membrane, and this is a glomerular capillary. So these Streptococci or dead antigens, actually they are not alive. Dead antigens of Streptococci, they come and settle here, and the circulating antibodies also, they find their way to the glomerulus where they bind to the dead antigen. I mean the circulating antibodies specific for Streptococci raised when the child gets infected by Streptococcus pyogenes in the tonsil. So some antibodies, specific antibodies, will be formed and they find their way to the circulation. However, when they find the dead antigens of Streptococci here, they will bind to these antigens, and this will lead to formation of immune complex. As can be seen here, the immune complex, it is antibody and the antigen of the dead. These antibodies are specific for Streptococci pyogenes, and this antigen, it is from the dead Streptococci here as the basement membrane of the glomerulus of the kidney. So formation of this immune complex will lead to activation of the complement component number 1, and this is C1q of the complement component number 1 will come and bind, and this will lead to a cascade of events result in activation of the classical pathway of the complement and result in formation of membrane attack complex and aflatoxins. And aflatoxins, these are short fragments of the complement components number 3, 4, and 5, and these they will lead to inflammation or glomerulonephritis. However, some of these immune complexes may get deposited below the endothelial cells. This is a capillary, actually, glomerular capillary, and this has the endothelium. So when immune complexes get deposited here below these endothelial cells, this will lead to activation also of the complement system and will lead to destruction of some of podocytes. So destruction of these podocytes will lead to a degree of proteinuria. So patients with poststreptococcal glomerulonephritis may come to you suffer from maybe puffiness of hand, face, maybe scrotum, with a degree of proteinuria. And as can be seen here, these are the immune complexes, and this is a basement membrane here outside, and this is a capillary glomerular capillary, sorry,